Welcome, everyone, to a brand new episode of the Preventive Medicine Podcast. If you guys are tuning into this one, this is actually part 2 of our sleep medicine series. And on our first part, we actually talked to Dr. Chris Winters about sleep, kind of from the more medicine aspect, because he's a neurologist and also a sleep medicine specialist. So we talk a little about medication, that kind of stuff. But we have part 2 today. And sleep is such a large topic. We had to have 2 episodes on it. That's why it's back to back. So if you have not already, go listen to that first one and then come back before you listen to this one. And the best way to do that is to go to our website. Everything else is there, our mailing list, our socials, everything. I'm excited to get into this one to continue talking about sleep, so let's do that. Overcoming saber-toothed tigers and woolly mammoths, we must now face a new enemy, ourselves. With the rates of diseases such as heart disease, stroke, diabetes, depression, and many others ballooning, we must find a better solution to these modern epidemics. Welcome to the Preventive Medicine Podcast. We believe in building a foundation of health by means of prevention so that you can build the life you want and find fulfillment with no barriers. Hear from experts around the country on how to take your health into your hands. Take control and build a foundation of health for the life that you want to live. And now, here's the show. Like I was saying, we're talking about sleep again today, and this is another one of those guests, which I don't know how we get on this podcast because she's so qualified. So today's guest is Dr. Jade Wu, who is a PhD in clinical psychology and also completed a residency in clinical psychology at Duke, and is now also a board-certified sleep psychologist. So that's something I actually know nothing about, so I'm interested to hear about that. But aside from that, she's also a presenter and reviewer for so many top-tier journals, has been on all kinds of TV shows, podcasts, you name it. And her current research focuses on the treatment of sleep disorders in chronic illness. So welcome to the show, Dr. Wu.
Thanks so much for having me.
Definitely. Well, I am interested to hear about sleep psychology and clinical psychology because I have no idea what that is. So kind of what drove you to getting into that field and how did you get interested in it?
Well, it's kind of a funny story because my father is actually was a sleep researcher in the Chinese equivalent of NASA, so the Chinese Space Agency, and he was working with astronauts on researching their sleep, and I was like a little 4-year-old, visiting his lab sometimes. So I guess in a way, sleep research has always sort of been in the family. And then I got interested in psychology just because I was always fascinated by how the brain and how human behavior all work together. And so, I got my PhD in clinical psychology. I started out actually in anxiety and depression research mostly. And then I also got into Parkinson's research. But across all of these topics, everywhere I looked, sleep was like a common factor, right? Sleep was messed up in every condition, every physical and psychological condition. So I figured, if we can know more about sleep, if we can help people sleep better, that's just going to raise the water for all boats. So then that's how I got into this specialty.
Definitely. So can you kind of tell me, when you think of like a physician or something or a sleep medicine doctor, you think, okay, they're prescribing medications.
Sure.
What do you do as a sleep psychologist that's different from, let's say, like a psychiatrist or a sleep medicine doctor, quote unquote?
Sure. Yeah. So my area is behavioral sleep medicine. The behavioral is kind of the clue, which is that, I work with people on non-medication approaches to change the way they act and change the way they think about sleep. And depending on the sleep disorder, the behavioral approach could actually be the first line treatment. So for insomnia, for example, the American Academy of Sleep Medicine, American College of Physicians, all recommend cognitive behavioral therapy for insomnia as the first line treatment. So insomnia is kind of like my bread and butter, most of what I do, but there are also behavioral approaches to decreasing nightmares, realigning circadian rhythms, as you probably know, a lot of people with sleep apnea have trouble using their CPAP or PAP machines. So I help people to motivate them, to decrease their anxiety about it. So I do all of the non-medication things that make sleep better or help people to adhere to other treatments for sleep.
Definitely. Well, I like how you say that behavior is kind of the first line, because I think it should be in a lot of like traditional medicine stuff anyway. And
Yeah.
oftentimes you just kind of skip that part. So I love that. From your perspective, being the Preventive Medicine podcast, what is kind of the intersection? What does preventive medicine mean to you in that
Oh,
context?
I absolutely love the philosophy of your work and your podcast here because I think, you know, prevention, 1 ounce of prevention is worth a pound of cure, right? So when it
Hmm.
comes to sleep, I think that's particularly pertinent because sleep is such a basic biological need and it affects every system in your body. It is affected by so many things that we do, and the things we ingest and the way we think about sleep, the way we relate to our relationships and work and everything, that it's just so integrally part of every aspect of health and life. So if we can, identify problems with sleep early on, or even before we have any problems with sleep, and help people to have this part of their life be very healthy, then I think we're preventing a lot of problems. I mean, if you think about it, we spend about a third of our lives, you know, sleeping or trying to sleep. So if you live to the ripe old age of 99, you'll have spent 33 years sleeping or
Wow.
trying to sleep, right? So, you know, what kind of relationship do you want to have with sleep when you're spending so much time with it? So that's the kind of lens that I'm working from.
And I hope it's not 33 years trying to sleep, and hopefully it is
Right,
actual
exactly.
sleep. But
Ideally.
I also like how you mentioned that it's something that everyone does do. Like, you have to sleep in a day. Everyone's going to be sleeping, and it's one of those exposures. I think we also discussed in the context of nutrition that everyone eats, everyone sleeps, and it's something that we don't really put too much emphasis on at
Right.
times, even though it's something that's so important and impacts every single aspect of our lives. Like you were mentioning, from our relationships to people and to food sometimes,
Hmm.
and to like pretty much everything you can name.
Yeah.
Um, for sure. So before we go on, I know this wasn't in the outline that I sent you, and this is kind of could be a long question, but kind of to set the stage for this, can you briefly describe the stages of sleep, just so we have like a little primer on what we're going to be getting into?
Sure. So, first of all, I would say that I prefer to think of it as different types of sleep, not stages. Only not to split hairs too much, but only because when we say sleep stages, it sounds like some are better than others. And the
Hmm.
further stage you go, the better. And we should be like leveling up, like in a video game, trying to get to later
Hmm.
stages. But that's not really how it works. I like to think of different types of sleep almost like different types of nutrition. Just like you want a balanced meal, for your dinner, you want a balanced night of sleep, right? So there are different types of sleep. We have what's called stage one sleep, which is really kind of restful wakefulness. It's just a few minutes throughout the night, you know, mostly serving as a transition between fully being awake and other stages of sleep. We have stage two, which is also called light sleep. And that's where we're pretty easily woken from it. So that's why it's considered light, but that doesn't mean it's not important. Lots of things are happening in it. We have brain activity called spindles and K complexes, and those are helping us to consolidate memories and rest and learn things. And then we have something, a stage three, which is also called deep sleep sometimes, also sometimes called slow wave sleep or delta sleep. And this is the type of sleep where we do more of our bodily repair, um, more of the restorative and janitorial work in the brain. So we're clearing out toxins, we're healing the body, the immune system is getting a boost. So very important stage of sleep also. Oh, and by the way, stage two sleep is supposed to take about 50% of the night, so about half the night.
Mm.
Many people are worried when they see that they only got like 15% deep sleep last night on their sleep tracker, but that's actually really normal. About 15% is about what you're supposed to get for deep sleep. And last but not least, we have rapid eye movement sleep, or REM sleep for short. And this is a totally different type of sleep that's really fascinating. The brain waves look very similar to when you're awake.
Hmm.
Um, and this is where a lot of the emotion regulation, dreaming, and other things are happening. Our bodies are sort of paralyzed. Our major muscles experience atonia, so we can't act out our dreams. So that's a adaptive good thing. But our brains are very active, and we have a lot of cognitive and emotional activity going on. So dreams and nightmares usually happen in REM.
Yeah, I like how you mentioned the kind of people get worried when they see 15% in deep sleep,
Yeah.
because people think, like you were saying, that there are different like stages of a game where the deeper you are, the better you are, and the better your sleep
Right,
quality.
right.
So that's why I kind of wanted to bring that up at the beginning of this podcast, so that we know that this is normal. Like you're not going to be your entire night in deep sleep. So I just wanted to set that stage.
Yeah, for sure.
So getting straight into it, we're going to discuss chronic illness within the context of sleep. So I guess the first thing is, how does poor sleep quality affect the risk of various chronic diseases? I know that's a broad question, but however you want to take
Sure.
that.
Yeah, so having poor sleep kind of raises the risk for everything else. When we have poor sleep, we may have higher inflammation, we may have lower immune response, we likely experience exacerbation of other symptoms like pain, um, and it's really not so good for our mood either when we don't sleep well. So whatever chronic illness you're dealing with, it's probably already anxiety provoking and maybe causing some depression or frustration. That's going to be magnified even more with not enough sleep. So
Hmm.
certainly sleep has a role to play in all of these things.
Yeah. So as you were saying, it definitely impacts everything. I think I read, I mean, I'm not super well read in sleep. I don't have, unfortunately, I can't read everything, but I think there
For
was
sure.
like something I was reading where like your T cell activity for your immune system goes down by like 40% through like chronic sleep deprivation, which is pretty significant amount. So it can definitely affect just various parts of the body.
Sure.
But
Mhm.
one of the other questions I have here is that, so when people think of like risk mitigation, in this podcast, we always joke that we have a terrible name. We should be like the risk reduction podcast. So when it comes to risk reduction, is this kind of like a smaller risk factor where if you don't sleep enough, that it's like, okay, I can mitigate this risk somewhere else? Or is this something that's like unavoidable, large risk that you have to sleep? Otherwise, you're putting yourself at very large risk.
I mean, that's such a great question. And I kind of want to answer it in two ways because, as we'll probably talk about later, the way you talk about sleep really depends on who you're talking to. And there's not really one universal message to
Hmm.
all of your listeners. So, what I would say is for the people who are like only giving themselves 4 or 5 hours of sleep and they're like, it's okay, I'll make up for it with coffee or something else. I say to them, no, 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 no. Yes, sleep is irreplaceable. Coffee is false fuel. It is not actually giving you the rest and the other vital activities that are happening during sleep. So you cannot train yourself to need less sleep. You cannot replace sleep with other things. On the other hand, now let me kind of turn around and talk to people with insomnia who have trouble falling asleep, who have trouble staying asleep, and are really worried about their sleep. What I say to them is just because you are having trouble falling or staying asleep does not mean you're chronically sleep deprived. So when you hear messages like chronic sleep deprivation is going to give you dementia and is going to give you a heart attack and it's going to be awful, um, of course you're going to be feeling very anxious hearing those
Hmm.
messages, but those messages likely do not apply to you. Because here's the thing, insomnia and sleep deprivation are two different things. And here's the way to think about it. If you are sleep deprived, you are going to be very sleepy. Like even prisoners of war who are in extremely anxiety provoking situations, when they're sleep deprived, even they get so sleepy that they can't help but fall asleep standing up, shackled to the wall, right? So if you're sleep deprived, you're going to be sleepy. And if you're sleepy, you're not going to have insomnia. You're going to be able to fall asleep and stay asleep, right? So these two things are different. There is some overlap. For some people, they do have both. And usually those people also have other sleep disorders like sleep apnea or a pretty significant case of PTSD, which
Hmm.
can kind of mess with how all of that works. But for most people with insomnia, they are not sleep deprived. So I hope that kind of answers your question.
For
It's hard to
sure.
answer a lot of these because the message really depends on who you're talking to.
I know. And it's always difficult when we come on and discuss large topics like these because we don't have like 3 hours. We don't have
Right.
time to like sit in a lecture. You obviously went to school for this and you got like an entire education on this. We can't do that within an
Right,
hour. But I
right.
do appreciate how you kind of broke it down into those two kind of subsections,
Yeah.
because there are definitely those splits where you have the people who sleep 4 to 5 hours. Might have been me at some point, not going to admit to that. But I think everyone has had that period at some point.
Sure.
But also I
College,
wouldn't.
medical
Yeah,
school,
exactly. Residency.
residency. Certainly. I do
Yeah.
not envy you that. I'm sorry.
Yeah. Yeah, residency is just a different circumstance. So where like you
Yeah.
don't have an option, you just have to live on whatever you can.
Yeah.
But I wouldn't even think to kind of split those two populations up between like the people with insomnia and whatnot and the people who choose to do it. So I
Hmm.
like that you did it that way. When it comes to kind of those already battling chronic diseases, does that change how they sleep? For example, let's talk about like some medical things. So, for example, if someone has like hypertension, diabetes, all those kinds of things, does that change sleep, or is it mostly just like the mood disorders?
Yes, and yes, all of the above. So, yeah, so when you have a chronic disease, it tends to disrupt sleep. So, the things you mentioned, hypertension, diabetes, another common thing that I see comorbid with sleep problems is chronic pain, cancer, um, all of these chronic diseases can make it more difficult to sleep through a lot of different channels. Like if you have pain, obviously you're uncomfortable, it's harder to sleep. If you have hypertension, your body is less able to sort of rest and do the things that it needs to do to fully get into sleep at night. So, yeah, there are lots of channels through which chronic disease can affect sleep. And at the same time, having poor sleep can also exacerbate chronic disease. So it's kind of a two-way street. And that goes for both physical and mental illnesses. So depression certainly makes it more difficult to sleep. And having insomnia makes one more likely to have more severe depression, more likely to relapse into depression. Um, Poor sleep can also even trigger things like manic episodes or psychotic episodes or seizures for that matter. But those are more extreme cases. So again, people with insomnia, don't worry, you're not walking around about to go like have a seizure just because you have
Mhm.
insomnia. But yeah, all to say that it's a two-way street. All of these are intertwined.
Sure. And kind of for my own curiosity here, we were kind of talking about chronic illnesses in this, but I want to switch to like acute illnesses because what
Mhm.
in the hospital as a physician, you're going around, you're seeing people in acute times. Obviously,
Yeah.
someone has like an exacerbation, COPD, a heart attack, all of those kinds of things. And unfortunately, in the hospital, sleep is not something that happens very well,
Right.
whether that be just because it's extremely uncomfortable to be in a hospital or
Right.
whether it's you're in a setting where someone's coming in and like taking your blood every like 4 hours.
Right.
I don't know how much you kind of have looked into that. I've studied that, obviously more than me, but kind of what are the effects of kind of acute sleep deprivation in that setting?
Sure. I'm so glad you bring that up because one of the lowest hanging fruits, and maybe this is not low hanging fruit because I don't know about logistically running a hospital,
Hmm.
but I think if we could just improve sleep for all patients just by a little bit, we're going to see better outcomes for all of these patients that you just mentioned.
Hmm.
So post surgery, post heart attack, in any sort of acute recovery from anything, um, even with things like infectious disease, if people could sleep better while they're in the hospital, they would probably recover faster because, again, their immune response
Immune
is better
function,
when
yep.
they sleep well. Inflammation is lower when you sleep well. You're able to physically heal the body better and release the growth hormones and the things that you need to release when you're sleeping well. But I also want to bring up that it's not just sleep deprivation in the hospital that matters, it's circadian disruption.
Mm.
So circadian system is, our 24-hour system of complex network of billions of clocks in our bodies, that run the timing of everything from metabolism to gene expression to cortisol, heart rate, everything, right? So ideally, everything runs in sync and on time. Think of an orchestra with 100 different instruments. Well, your body is like billions of different instruments, and if they all play in sync and on time together, then that's how the machinery works the best, right? Um, and part of what keeps your circadian system functioning well is having that consistent night day rhythm, having very dark nights and very bright days, sleeping at about the same time every night. Doesn't matter if it's late or early, just if it's consistent, it's good. Um, and having that robust kind of up and down fluctuation in your sleep and in all your other systems is just generally good for health and recovery too. So in the hospital, instead of having lights on all the time and noise on all the time, if we could make a really distinct difference between day versus night, like only having orangey lights and very dim at night, would go a long way because that would tell our brains, okay, you're not living in a cave and you're not living in a laboratory. You're living in the real world where the sun rises and sets. And that really actually helps our bodies to recover better.
For sure. One of the things I really appreciate about the field of PM&R when you're kind of in the acute hospital setting is because we function on kind of like a longer time scale with our patients where they're not if they're in for acute inpatient rehab, they're not there for like 3 or 4 days like they would for any other acute hospitalization. They might be there for like 2 to 3 weeks. And the interventions aren't as acute where you're not just like, you don't need to take their blood necessarily every single day because they're in there for a rehab. If they have like a medical condition where you need to do it, then sure, maybe. But for the most part, it's like a 2 to 3 week extended. You're there to rehab. You're not there for quote unquote medical treatment.
Good.
Although you might require some sort of medical treatment. So you can definitely start to prioritize sleep a little bit more, which I find beneficial.
Awesome.
And I find that could be a huge help with rehab, I guess. I haven't looked into the research so much on that yet, but we'll get there with time.
Yeah, there's definitely research on that. Absolutely. You'll find confirmation of everything we've talked about.
For sure. And so we've kind of discussed the pathology aspect of it, the illness aspect of it. So let's get into a little bit of the treatment kind of before we go into the more practical for listeners back home aspect, which is you provide non-medication solutions like behavioral therapy. What is that?
Well, depending on the sleep disorder. So the main one that I work with the most is insomnia. So insomnia, again, is trouble falling asleep, trouble staying asleep, having daytime symptoms because of that, and having, distress about sleep problems. So behavioral therapy or cognitive behavioral therapy for insomnia really targets the things that keep insomnia going long term, because we all have a bad night here or there, like sometimes we choose to. We pull an all-nighter, on a party night or like a study night, and we just have to deal with it, and that's fine. We'll recover after that. There are also maybe somewhat longer-term life circumstances that make sleep more difficult, like if you have surgery or you get a divorce or you have a baby. These are all short-term things, though. When that circumstance passes, most of us get back to baseline with our sleep. So why is it that some people have insomnia for years after their baby is grown, years after their divorce is finalized, years after they've left that stressful job? That's because there are perpetuating factors that keep insomnia going. So if we can identify what these perpetuating factors are and take those logs out of the fire, then the fire runs out of fuel and burns itself out, right? So these perpetuating factors, it turns out, are the ways that we act around sleep and the ways that we think about sleep. So for example, have you ever talked to a patient who was like, oh my gosh, I could not fall asleep last night, or I woke up during the night and I immediately started thinking about how I only have 4 more hours to sleep. I'm watching the clock and it's ticking and ticking, and it's like I'm running out of time and I'm going to be so tired tomorrow. And oh my gosh, my grandfather had dementia. Does this mean that I'm going to have dementia because I'm having sleep deprivation? Does that sound a little bit familiar? Like how some people said that?
I mean, mash a whole bunch of patient interactions to that and you have pretty much that.
Yeah. So there's a lot of anxiety about sleep baked into insomnia. So when you shine a big spotlight on the fact that you don't sleep well, when you think about it in the middle of the night, when you're fretting about it, tossing and turning, then that is just raising your frustration, raising your anxiety, also teaching yourself to be awake and frustrated and anxious in bed, right? So all of that increases our physiological arousal, and that makes it harder to sleep. So a lot of insomnia is kind of a vicious cycle, like a self-perpetuating cycle, where the more we worry about it, the more we don't sleep well. So part of behavioral and cognitive therapy for insomnia is to first correct some misconceptions about sleep and to find ways to compartmentalize worry and anxiety, and to find more helpful ways of relating to sleep, having a better relationship with sleep so that we're not really like treating it like an enemy or a chore, but rather treating it like a friend. So that's part of it. And there are also some more sort of um, bare bones biological, physiological resets that we do. Like we have people um, potentially spend less time in bed because often people with insomnia are spending way too much time in bed trying to make up for lost sleep. So they're going to bed long before their circadian rhythm is ready for sleep, before they have enough sleep drive built up, or they're lingering in bed in the mornings. And what that means is they don't have enough time outside of bed to actually build up the sleep hunger, the sleep drive that they need
Hmm.
in order to sleep well. So often we think of sleep backwards, like, oh, how much sleep do I need in order to function during the day? But we don't really ask, how much functioning during the day do I need to do in order to earn good sleep?
Hmm.
Right. So we kind of turn these perspectives around and help people to do a hard reset on their sleep physiology and get back to baseline. So
Yeah, I
those are
really
just some
appreciate.
examples.
Sure, I really appreciate that explanation because this is not something you would typically think of when you think of insomnia. You don't think about all these feelings and all these thoughts that people have surrounding sleep.
Sure.
When it comes to like the medicine aspect, or I guess when you talk to your friends or someone who's complains of insomnia, oh, I just take some melatonin for it and it can help. Or when you speak to like a physician who might not be as educated on, they'll be like, oh, I just prescribe some Ambien, some other sleep medication, whatever it is. And don't really get to kind of the root of what insomnia could be. So I really appreciate that
Exactly.
explanation. Definitely learned a lot from that.
Well, you hit the nail on the head, I think, with talking about the root of the issue. Because sleep medications, I mean, there's a whole diverse range of what they are and how they work, but essentially they're helping us to either dampen everything down, um, or they're helping us to forget waking up at night. So you mentioned Ambien, the number one most
Hmm.
popularly
Yeah.
prescribed insomnia medication. So that if you measure the objective sleep changes with Ambien, it's not much. It's like 5, 10 minutes, faster to fall asleep. Maybe like up to half an hour more total sleep, but like there's a huge variation in how much, whether that's even achieved. But what happens is people forget that they woke up during the night. So then it feels like they slept more. So these medications are not really getting to real improved sleep and not really taking away those perpetuating factors that are keeping insomnia going, which is why cognitive behavioral therapy is the first line treatment
Hmm.
recommended by all of these, bodies.
Yeah.
Um, and it's not just because it's like, oh, let's do this because it doesn't involve medications, fewer side effects. All of those things are true, and that is good, but it also just works better too. Like
Hmm.
with medications, once you stop taking Ambien, you lose the effect of Ambien. But with behavior therapy, once you learn the skills and the concepts, you have those for life. So, in the calculus of all things, it's actually less expensive and more effective to do behavioral therapy for insomnia.
Yeah, I was actually going to ask kind of the effectiveness because you were mentioning it as the first line, which you also just did now. But typically, when you think of a first line, you think of it as really effective, or like a very large proportion of patients are kind of cured from that.
Yes.
Would you say it kind of works that way?
Yes, it does. And so there's at least 124 good quality clinical trials showing that cognitive behavioral therapy for insomnia works. Um, and depending on the trial, I mean, there are trials where they had people just with insomnia, and plenty
Hmm.
of trials where people had insomnia and chronic pain, or and depression, or and PTSD, and sleep apnea, and whatever. So we know that this treatment not only works for people who are otherwise healthy and just have trouble sleeping, it also helps people who have insomnia that maybe originally uh, occurred because they had cancer or underwent some surgery
Hmm.
or treatment. But now they have insomnia and the other disease. And we can actually just isolate the insomnia and target that, and that'll improve sleep and improve some aspects of the other disease as well.
Wow.
So yeah, that's pretty powerful, right?
Yeah, definitely. So, kind of after that first step as the first line, what's next after that if kind of the behavioral therapy doesn't work? Is that where you start going towards medication? And if so, kind of what is the treatment plan for that?
Yeah, yeah. Um, so out of all of the American Academy of Sleep Medicine recommended treatments, the only one to receive a strong recommendation, meaning if you're a clinician, you should, under most circumstances, follow that, is cognitive behavioral therapy.
Hmm.
Um, After that, it's either individual components of the cognitive behavioral therapy or medication. So none of those other things, including the medications, receive a strong recommendation. But yeah, so after that, you would sort of look at the whole symptom profile to see, if someone does have depression and insomnia, perhaps a sedating antidepressant would make sense. So of course you know much more about prescribing than I do. I'm not a prescriber. But that, I think it really comes down to clinical judgment at that point.
And I wouldn't even say I know that much about prescribing specifically sleep medications because that's not something that I know. But it's amazing that I actually have not heard of so much effect happening from CBT for
Yeah.
insomnia, because it seems super efficacious and super, like, it's just like a really good thing but I don't hear about it and I don't know
Right.
why. So I'm really happy to be talking to you and learning about this.
Yeah, isn't it funny how CBT is kind of a no-brainer for insomnia, but for many different reasons, most people, even highly educated doctors, like you, do not know about it. Or even if they know about it, they don't have any CBT specialists to refer their patients to. So that's definitely a big problem.
We want to take a quick break to remind you that this podcast is not intended for medical advice and is for educational and informational purposes only. We also want to remind you of our Instagram page @PreventPod, where we share various content relating to each episode that you can share with your friends if you enjoy our episode. And lastly, don't forget to sign up for our mailing list so you know right away when an episode goes up at www.thepreventivemedicinepodcast.com. And with that, let's get back into this episode. Yeah, so definitely. I think one of the main things is always being aware of what exists in the spectrum of treatment and the spectrum of specialists so that you know where to refer to and where patients can get help. Because obviously, as one person, you're not going to be able to do everything. You can't provide the entire range of treatments for any disease.
Sure.
So it's nice to be informed about this. So moving on to kind of the second half of this podcast, which is kind of, I think, what a lot of people want to hear about, is kind of more about how can they get better sleep.
Sure.
And with the conversation around that comes sleep hygiene. So what does good sleep hygiene look like? I know you mentioned it briefly in the first half of this. And then how do you create a sustainable sleep schedule?
Yeah, so first I want to clarify what sleep hygiene means. So usually when people hear about sleep hygiene, it's a list of kind of do's and don'ts, like don't drink coffee close to bedtime, don't exercise too close to bedtime, consistent schedule and things like that. So I would say, here's how I think about sleep hygiene. It's kind of like dental hygiene. It's good to have in general. It's good preventative stuff. But once you already have a cavity, dental hygiene, flossing is not going to get rid of your cavity. Just like if you already have a sleep disorder, just doing sleep hygiene is not going to cure it. So when we talked about cognitive behavioral therapy for insomnia, that is not the same thing as sleep hygiene. So just want to clarify that to begin with. So in case anyone's listening who has insomnia, you've probably already tried sleep hygiene. It probably hasn't worked. It is used as the placebo condition in a lot of our trials. So not surprised if it doesn't work. But generally, I would say it's very hard to give a universal list of sleep advice items that really suits everybody. But I think the safe items to say are, one, if you can keep a consistent sleep-wake schedule, that will be really, really good, because earlier we mentioned the circadian rhythm. This is a sort of underestimated aspect of sleep. We talk about sleep itself as if it happens in a vacuum, but it happens against the background of 24-hour rhythms. And so having the same, say, 7 hours of sleep, but at the wrong times or broken up into chunks, is not going to be as good as if you have it, at night during the time that most suits your chronotype. Chronotype refers to whether you're a natural born night owl or morning person, somewhere in between. So I would say be consistent, including on weekends, days off of work. Try to be within about an hour of when you wake up. And if you're consistent enough on the morning end in terms of when you wake up, then your body should let you know when to get sleepy in the evenings to give you the sleep that you need. So listen to your body, but give it some guardrails, like getting
Mm.
up at the same time. And also having some wind down time in the evening so that you actually can hear your body say, okay, I'm sleepy now, let's go to bed. I've been talking with a lot of patients, especially during the pandemic, where now they're working from home. They
Oh
can
yeah.
work anytime they want, which sometimes means they're working late into the night. They're flipping shut their laptop and then rolling into bed.
Hmm.
That's not enough of a wind down time. You either are going to bed too early because you feel so exhausted from work that you just want to shut everything off, but maybe you're tired but not sleepy yet, in which case you're going to have insomnia. Or you're going to bed too late. Maybe already like an hour or 2 hours ago, your body was trying to tell you that it needed sleep, but you didn't hear it saying that because you were too busy answering work emails. So you really ought to give yourself um, a couple hours in the evening at least where you've switched away from doing mode, the productive hustle bustle mode, into being mode, where you're relaxing, you're listening to your body, you're resting, and you're getting in touch with the parts of yourself that are also really important other than work, like your relationships, your
Hmm.
mental health, your self-care, all of those things. So those are, I would say, the consistent wake time, sleep wake schedule, the wind down in the evenings, getting enough rest during the day. So not, going 80 miles an hour all day and expecting yourself to slam on the brakes at bedtime. Giving yourself chances to actually breathe, to reset your eyes, to mentally reset, to get grounded in your body. That's also really important for nighttime sleep.
You said a lot of important things in there. I want to go back all the way to the beginning, emphasize one thing first, which was the kind of, if you already have a sleep disorder, then sleep hygiene might not or probably will not work for you. And that's really frustrating for a lot of people because some people who have difficulty with sleep, the first thing everyone tells them is sleep hygiene. So then
Right.
they start with like the regulating their wake up time, sleep time. Then it comes down to like caffeine. And then they start eliminating caffeine. All of a sudden they go from like whatever, how much caffeine they were having to none. Next thing you know, they're buying blue light glasses because all these companies are telling them that that's the problem. And it
Right.
can become really frustrating and nothing works. Why? Because they actually have a sleep disorder.
Right.
So if you're listening to this and that kind of fits your build, and that's actually a really important distinction to make, and I'm really happy you brought that up.
Yeah.
Um,
And in
the,
fact, working too hard on creating the perfect sleep hygiene routine contributes to insomnia because that's you're working too hard when you're putting that much effort and energy and attention on the fact that you're not sleeping well and trying to perfect it and be too rigid about it. That actually increases arousal and makes it harder to sleep. So, and it's also funny because when I talk to patients, uh, almost everyone has tried sleep hygiene before they get to me. Um, but it's the items in sleep hygiene that are most likely to actually help them that they sort of tried and gave up on really quickly. Like they heard that they should do a consistent sleep wake time, so they tried going to bed at the exact same time every day. But then they would sleep in sometimes or not sleep
mm,
in other times, and then they would get wishy washy on the morning end. But it's the opposite. You can't really control when you fall asleep, but you can't control when you set your alarm clock and when you get up, right? So
mm.
do the part that you can control, which is to get up at the same time every day, and then be more flexible and go with the flow and listen to your body for the part that you cannot control, which is the evening end. So it's funny because when people get to me, they've like tried different bed sheets and like Himalayan salt lamps and all these products. And oh man, there's a reason why there's such a huge industry in sleep aid products, right?
Definitely.
Because people are so desperate to get good sleep. But almost none of those products is really going to move the needle on your sleep if you have insomnia. It's certainly not going to be the answer for your insomnia.
And that's a really nice and cool reframe because when you think about sleep hygiene, everyone tells you about go to sleep at the same time, but no one kind of talks about wake up at the same
Yeah.
time. And it makes perfect sense that you can control when you wake up a lot easier because you have an alarm clock. Once an alarm clock hits, you're essentially awake. And any sleep you get after that isn't real sleep anyway.
Right.
So I like that you put it that way. And also, this is kind of why we bring guests like you on because there's this entire industries propped up on non-evidence based type things where they try to help people sleep, but all you have to do is try to wake up at the same time. and make that an enduring behavior. Like anything else that we talk about with exercise, nutrition, all those things, it has to be enduring. You're not going to fix your diet over 1 week. It's going to take a long amount of, or a longer period of time. So
So
it's the same
true.
thing for waking up. So
It's so
I
true.
really appreciate that reframe. That's amazing.
Yeah, yeah, and I'm glad you brought up exercise and nutrition too, because those are also intricately linked to sleep. So if we are talking about kind of universal sleep advice that I would give to anyone, I would say, eat nutritious meals and don't starve all day and eat one giant dinner. Spread your meals and snacks out, and make sure you eat something first thing in the morning. So even if you're not a big breakfast person, at least eat something to get your metabolism started, because that actually gives a strong signal to your circadian system about what time it
Hmm.
is in your 24-hour cycle. So if you're waiting all the way until evening to eat your big meal, maybe your only meal of the day, then you're telling your body at 8 p.m. that, oh, the day's just starting. So then of course you're going to have trouble falling asleep, not to mention your core body temperature is high and your metabolism is still working hard by the time you go to bed. So meal timing and nutritional value of your meals does matter for sleep. And exercise, that is like the number one best thing you can do for your sleep, is to exercise pretty consistently, routinely. It doesn't have to be a marathon. It doesn't have to be like Arnold Schwarzenegger lifting regimen or whatever.
Hmm.
It's better to even just, I mean, you know about the specifics about that better than I do, but I would say if you can walk every day, that would be certainly better than nothing. And better maybe than one big sprint of something once a week. So yeah, being active, you're building up your sleep drive during the day. You're releasing all the good, neurotransmitters. You're balancing, the mood needs of your body and the physical needs of your body. It's just generally exercise is kind of the answer to everything.
I can emphasize that point, especially. I'm a huge proponent of exercise, big exercise chill here. I also want to say I did not know about the starting your metabolism off in the morning and how that is
Mhm.
related to circadian rhythm. So that's also something I didn't know. I'm learning so much from this podcast. So thank you for that. First
Great.
off, I
Yeah.
also want to ask you. You mentioned chronotype, and like that
Mhm.
refers to like people whether like to sleep late, whether they're night owls, early birds, those kinds of things.
Mhm.
Unfortunately, sometimes given the demands of life, you have to start a day at like 8 a.m., 9 a.m. But for someone who can't get to bed by like 3 a.m., my brother, then kind of what do you do for that situation?
Yeah, yeah. So if you absolutely cannot get more flexibility in your work or family or social obligations, that's okay. We can, I'm a night owl too by nature, but we night owls can actually kind of fake it till we make it. And we can actually shift our melatonin timing to resemble that of a morning person's. So one of my favorite studies of all time, they did this in Colorado. They took people who are biologically hardwired as morning people and people who are biologically hardwired as night owls, took everybody camping. And so they had no screens in the evenings. They only had orangey firelight, after sunset. And of course, they're sleeping in tents. So like once the sun is up, it's bright,
Yeah.
and then they're up and like in the sun all day, not necessarily in the sun directly, but they're getting bright light exposure
Hmm.
all day.
Hmm.
So after like 4 or 5 days of camping, all of the biological night owls were more like morning people, both in their behavior and how they felt and when they wanted to and felt like sleeping, and even in their melatonin profile.
Hmm.
So it is possible to sort of train your chronotype using things like light exposure, and very, very specifically dosed and timed melatonin. So don't do this on your own. Talk to a sleep specialist to do this, because if you do this at the wrong time of day or night, you can go backwards. So, we're not going to get into all the details here, but essentially,
Once again, no medical advice on this podcast.
no
Just
medical advice on this podcast. No, none at all. Talk to your doctor. Like, and on this topic specifically, talk to a sleep specialist.
Mhm.
But with light, what I would say to your brother is get a bright dose of light first thing in the morning. That will help to tell his brain when it is daytime, like start the whole machinery of starting the daytime part of the 24-hour cycle at that time, and to get lots of bright light during the day as much as possible. So, for example, I have a ring light here that's like,
Same here.
yeah,
Yep.
that's good because, we're probably sitting inside. I mean, even with a window right here, that's not enough light exposure during the day. So we need the extra bright light if we're inside. But better yet, go outside. That's double whammy. You get the exercise and the triple whammy and the fresh air and the light. So that's all good. And then in the evenings, I mean, we don't have to be super sticklers about this, but dimming our screens a little bit, um, like putting on night shift on our iPhones and iPads, things like that. That doesn't make a huge difference, but for a severe night owl, like someone who's a 3 a.m. bedtime
Yeah, that
person,
would be my brother. 3 to 4
yeah.
a.m.
Okay. So yeah, for him, he's actually probably more sensitive to light exposure at night in terms of shifting his circadian rhythm backward, like later. So if he's like on his iPad at 2 a.m., that's definitely more detrimental to him than to somebody else on their iPad, earlier in the night. So yeah, less light at night, more light during the day, and consistency on the morning end.
Sure.
That's really what it boils
What
down
about
to.
like the total hours of sleep at that standpoint? Because you said you can't like kind of sustain on 4 to 5 hours of sleep, but if for some reason you can't sleep until like 3 a.m. and you have to wake up at 8 or whatnot to go to work, what do you do
Yeah.
in that circumstance? Is just the answer is naps or?
I guess naps. Yeah. I mean, ideally, you would think really hard about why it is that your schedule is like that. And, for a lot of people, they don't have a choice. They have multiple jobs to feed their
Yeah,
family.
that was
And
actually
that,
a follow-up question. So I'm happy that you're addressing this now.
yeah, I mean, that is really, really, honestly, it's tragic. And that's why there's sleep health disparities between majority and minority races in America and perhaps elsewhere too, and people who live, who work jobs that are like night shift jobs, for example, are more likely to be Black Americans, um, poorer Americans. So that's why there is a huge gap in our sleep health, right? Because when you work the type of job that allows you a comfortable, flexible schedule, then you can kind of work with your chronotype
hmm
more and get enough sleep.
hmm
Whereas if you can't help it, but you don't get home from your job until midnight, but then you have to be up at 5 for your next job,
Yeah,
then there's really not much that can be done about that. But yeah, strategic napping is kind of one small way we can mitigate it. So whenever possible, catching up with some short naps, um, trying to be consistent about that if possible, so that we're not doing like no napping on some days, but like 3 hour naps on other days. If we could spread that out to be like 1 hour naps each day, depending on the situation and availability of time, it's really, really tough.
sure.
But yeah,
Dr. Winters was mentioning how acute periods of sleep, kind of not sleep loss, not deprivation, can kind of be made up kind of on the weekends. So if there is more
yeah,
time to sleep on the weekends, if you've not heard that part, go listen to the first part of this podcast series, I guess, on sleep. So you can hear a little bit more about that. I also just wanted to say that's incredibly unfortunate because you have kind of like that triple whammy where
yeah,
you have multiple jobs, so you can't sleep that much. And then because you can't sleep that much, it affects your physical health. And because it
mhm,
affects your physical health, you might not be able to work at your jobs as like best you
mhm.
can, and affects your mental health. And then it all just kind of compounds on each other and you stay within this loop. And it's very difficult to get out because job advancement is very difficult if you're not performing at your best, you're not at your mental best, your mood best, all those things. If you can't, you're going to stay with minimal sleep. If you're going to stay with minimal sleep, it's going to affect your health.
Yeah,
It's terrible.
it is awful.
I hope we can find a way to combat it.
That is a huge gap in our research in our field. I mean, we've come up with all of these treatments for insomnia and for other sleep disorders, but it's like, okay, but we can't actually implement a lot of this for people who literally
hmm
cannot implement
Yeah.
these things. So yeah, and I would say, I'll just leave it at that because it's too huge scale of a
Yeah.
problem.
Yeah, at the end of every podcast, we tend to get a little bit more philosophical and we get like
Yeah.
larger because the scope of our problem just keeps increasing. We always end up at
Yeah.
public health somehow in policy, but that's kind of unavoidable. That's how like public health and preventive medicine kind of goes. So,
Yeah,
um, on,
exactly.
on the other spectrum of that, if you have someone who is kind of has more time to worry about their sleep, quote unquote, they get a sleep tracker. And then
Hmm.
now they start tracking their like REM sleep, their deep sleep, their like time in bed, all of those things. What are your thoughts on sleep trackers? Do they help? Are they beneficial, or do they kind of add more anxiety to the puzzle?
Great question. As a researcher, I'm excited about sleep trackers because now we have big data, right? We have just
Hmm.
unprecedented levels of data to look at.
Definitely.
So that's exciting. But as a clinician, when I talk to individual patients, especially those with insomnia, I would say this is probably hurting more than it's helping because one, it's not giving you any actionable advice, right? Like you might find out more information about your sleep, but that information isn't even presented to you in the context of sleep science most of the time. Like you get a
Hmm.
score or you get a breakdown of sleep stages, which
Yeah.
may not even be accurate. And then what do you do with that? You know, it's not like sleep is an involuntary behavior. It's not like exercise where you see, oh, I only did 8,000 steps. My goal is to be up to 10,000 next week. You can actually work at that. But with sleep, if you see that, oh, you got 10% deep sleep, what are you going to do to increase that percentage? There's nothing you can. So it just increases your sleep effort, increases your sleep anxiety. And if you see that you got 10% deep sleep, you might think that's terrible, but that's actually totally normal, you know, especially if you're
Hmm.
middle age or older. So I think it's in its current form, consumer sleep trackers for individual insomnia patients, probably not a good idea.
I think from the consumer perspective as well, you were mentioning how we have unprecedented amounts of data. I think on the consumer end of it right now, I don't even think that data is necessarily beneficial for clinicians because you bring in all this data that has no context for a clinician, and then the clinician is going to want to know what the setting is and like the context behind that data. So they're probably going to repeat it themselves.
Yeah,
And then they're going to make recommendations based off your own collected data because now you know the story behind it. So I don't
right.
think in general I would ever recommend. I mean, this is coming from me who's not necessarily a sleep scientist, but I personally would never recommend a sleep track or anything like that because there's no actionable items, like you were saying. The
Yeah,
data is not necessarily going to be beneficial to the clinician because they're probably going to repeat it themselves. And it's going to give you
yeah.
more sleep anxiety than anything else.
Yeah, and exactly. The only time where I might ask for someone's like say Fitbit sleep data is if I, especially if it's like a teenager or at younger patient who had seems to be like just totally out of whack with their circadian rhythm, and they can't even really tell you like
Mm,
how many times they sleep a day or like do they sleep at the same time? They can't tell you. You don't know. The parents don't really know. Then a sleep tracker might give you some ballpark idea of, oh, does this person have like a profound circadian rhythm disorder? Like they don't even have a 24-hour rhythm, or are they sleeping a lot more than they think or a lot less than they think? And then they're like willing to tell you, you know. So it might give some big ballpark ideas, but generally you're right. I don't think it's going to provide anything actionable for the clinician or for the patient.
you mentioned sleep trackers in their current form. I don't know if you're currently thinking of an idea, if you're an entrepreneurial spirit in this regard, or if you're going to give away some secret, but what do you think in the future would be improved that could make them beneficial for clinicians like yourself?
Yeah. So one thing I am kind of excited about is ambulatory EEG. So this is where we actually directly, well, almost directly measure brain activity. I say almost directly because we're really measuring like scalp, measuring indirect electrical activity in the
Hmm.
brain based on scalp,
Yeah.
activity, right? So, um, if we can, so right now the gold standard sleep measurement is the in-lab polysomnography, which is a
Hmm.
multi-channel EEG plus a bunch of other measures. If we can take that outside of the lab and have people just wear it in their own home environment, or even for more than one night at a time, that will be super helpful because now we're getting like an ecologically valid measure. We're getting more than one night at a time. And we're looking at actual sleep stages instead of these like accelerometer estimated sleep stages, which are not really that accurate. So I know that these ambulatory EEGs already do exist. There are a couple of products out there that I'm excited to learn more about. And I think they're probably, I predict that that's going to become a widespread thing within the next like 10 years or so, because there's such a need for it and the technology is like blossoming. So I'm sure it'll be around the corner.
Man, that just snapped my entrepreneurial spirit. I was going to make something, but it's already there. Of course, someone's probably already working on everything, so that's there.
Mm-hmm.
As we get to the end of this podcast, like I said, we always end up on some pseudo philosophical type of rant.
Sure.
And that, in this instance, is when it comes to sleep, not getting enough sleep seems to be something that is celebrated at this time because it's you're hustling, you're grinding, you're working hard, and all those kinds of things. And obviously, not getting enough sleep is detrimental, as we've discussed during the entirety of this podcast. How do we kind of reverse this trend? Because obviously, I would think you were trying to reverse this trend as much as you can. So how do we do that?
Well, I think one good starting point is helping people to understand where that idea comes from. And for many people, and since we were talking about sleep disparities, for many minority Americans, especially Black Americans, understanding that this hustle grind culture is a legacy of slavery and oppression can be really eye-opening. Because back in the days of actual slavery in America, slaves were in part kept in line, quote, by being sleep deprived. And also there was a big danger and stigma to falling asleep during the day, or sleeping anytime you're technically not supposed to, because then you would get punished or you would be seen as a lazy, whatever, if you're trying to sleep. So then that carried through generations of trauma and oppression. And so now what I'm noticing in my work with individual patients is that many of my Black patients are carrying this legacy of belief of, my grandparents worked around the clock and slept 4 hours a night to make this life for my parents that allowed them to make this life for me. You have to, I'll sleep when I'm dead. You have to hustle. You have to work hard. Even like major sports celebrities are saying, I get up at 4 a.m. to practice, as if this is like a moral good thing to be doing. Yeah. So then we're just entrenching these ideas that stigmatize sleeping and glorify sleep deprivation in order to get ahead. That actually has a really dark and tragic and violent past. So I think if we can recognize where that comes from, and for non-minorities too, I mean, the violence of serfdom and capitalism, of this idea of we have 8 hours work, 8 hours sleep, 8 hours for everything else. That slogan came from the days of early factories, making the industrialists rich, so this is all wrapped up in social injustice and social oppression. So at least for me, knowing this history and understanding the roots of where these unhealthy ideas of sleep come from really helps me want to push back on it and say, you know what? I deserve my rest. I deserve my sleep. This is my God-given right. I am going to shut down my computer and I'm not going to answer those urgent emails, and I'm going to rest because that's what I owe to my body and my life.
That it's incredibly powerful. I had no clue that this was kind of the history of it. In my head, I was just thinking of like, you see all these entrepreneurs on Instagram, YouTube, because they're like glorifying that they're up at 4 a.m. studying the stock market before the day starts and all those kinds of things. But I absolutely had no idea of the history of this and where it all came from. So thank you for opening my eyes to that, first of all. And I'm assuming this is going to be a first for a lot of listeners as well.
I hope so too. And those entrepreneurs and stockbrokers who are up at 4 a.m. checking stocks, I mean, we wonder why there were so many bad decisions leading up to the financial crash. Like, what if everybody on Wall Street slept like 1 or 2 more hours per night? Maybe would we be in a different place?
Yeah.
Who knows? But we do know that a lot of oil spills and traffic accidents and terrible decisions, invasions of countries, a lot of these things probably could be prevented if everybody just rested and slept more.
Yeah, and putting that back into the context of medicine, the same thing goes with physicians, where it's kind of glorified that you're at the hospital working and not kind of quote unquote lifestyle specialties get a bad rep because you're prioritizing your own kind of well being, your own sleep, all those kinds of things. So the culture of not getting enough sleep is kind of pervasive throughout everywhere now that you
Yeah.
think about it. And now knowing those roots, it kind of makes sense where a lot of this comes from.
Yeah, yeah. And if we want social justice today, sleep equality and sleep equity, sleep health is going to be a crucial part of that puzzle.
Sleep is the answer to world peace. We have
It
solved
really is.
everything on this podcast right here. Now, if we could only get
Congratulations.
everyone to go sleep and sleep for 33 years of their life if they lived to 99.
Yes, yes. Preach.
All right. I had a phenomenal time on this podcast. I learned so much. This is probably one of the podcasts that I learned the most on.
Oh, great.
I selfishly do these podcasts as well so that I can learn a lot, and this has definitely been one of them. I hope you enjoyed your time on this as well, Akabu.
Absolutely. This was so much fun. Thank you so much for having me.
Definitely. So thanks for coming on with that. We're out. We'll see you guys next week.